Pelvic Partnership is a small UK charity providing support and information to women with pregnancy-related pelvic girdle pain and to healthcare professionals involved in their care. This video will explain about pelvic girdle pain, demonstrate how easy it can be to treat, and encourage you to get help as soon as possible. Pelvic girdle pain used to be known as symphysis pubis dysfunction, or SPD. It causes pain in one or more of the pelvic joints and surrounding muscles, and causes difficulty in walking, bending, climbing stairs, and turning over in bed. Pelvic girdle pain affects 1 in 5 pregnant women. The good news is that pelvic girdle pain is treatable with hands-on manual therapy, and it's safe to assess and treat at any stage of pregnancy. It should be treated as soon as possible after symptoms begin. We've made this video because of your feedback asking what effective treatment for pelvic girdle pain looks like. Manual therapy is often available on the NHS. Ask your midwife for a referral to a physio as soon as you notice any symptoms of pelvic girdle pain. If you find that your hospital does not offer manual therapy or there is a long waiting list, you may choose to pay for private treatment.
Hi, I'm Becky. I heard about the Pelvic Partnership after I'd had my first baby and I had really bad pelvic girdle pain, and they pointed me in the right direction for some good treatment. I'm here to talk about my second pregnancy.
I am Lucy Walmsley. I'm a physiotherapist. I work in private practice. I treat a lot of pelvis problems, but I'm not primarily a women's health physiotherapist. I come from a very sport physio background. So I've worked in professional sport for many years, moved into private practice where I treat anybody and everybody, and came across women who had pregnancies or during pregnancies who were experienced pelvic problems, and so I treated them as I treat anybody and discovered that they seemed to do quite well with this treatment, which is how the sort of more manual approach to treating pelvic girdle pain has evolved. So what has brought you here today?
I've been having pain in my pelvis.
Okay.
At the front.
Yeah.
A lot at the back.
All on that side. Mainly.
Yeah. Sort of all around here.
Yeah.
And sometimes down the leg.
Okay.
It's especially painful at night.
And when did that start? Fairly recently?
I've been having little niggles for about 3 weeks.
Okay.
But it really started badly last week.
Okay. And is it getting worse, do you feel?
Yeah.
Okay. And how many weeks are you now?
25.
Okay. And this is second pregnancy, isn't
it?
Yeah. And how long ago was the first?
My son's 4 in January.
Yeah. Okay.
My first pregnancy, I had quite a bad time with pelvic girdle pain. It started around 25 weeks and I didn't really get any good treatment for it and went into the birth still in quite a lot of pain, which was quite difficult. And then the symptoms didn't go away straight after birth. So all in all, that was a really tough time.
Right, let's have a look at you standing. Okay, I'm just going to have a quick look at how you look. Okay, so I'm just going to have a feel onto her PSISs.
It's a tiny bit sore.
Is it? Just my finger pressure?
Yeah.
Okay, so that's the main seat of where you feel it, is it?
Yeah.
Yes, the pelvis is quite a complex structure with a 3-joint system. You've got the symphysis at the front, and you've got the 2 joints between the ilium and the sacrum. And all 3 of those joints have to have a degree of mobility to allow the pelvis to function well. Coming off all of these joints are ligaments, a huge number of muscles that link the limbs to the spine, and quite a lot of nerves that travel through the area. So it's a very complicated system. But essentially what can happen when we get pelvic pain is that something within this system has stopped functioning as well. So it doesn't necessarily mean that something is damaged or broken, it just means that something is not moving optimally, or one of the muscles is not working as well as it could do. And that can generate pain in any of those joints. So a muscle might become tight and then you can get this imbalance through the whole system. Just show me what you're like to bend forwards if you can, as far as is comfortable. You can have a little go at standing on one leg. If it's horrible, shout, but if you can you bring this knee up towards your chest? Lovely. And down again. in order to really work out why they've got pain, I need to find out what works and what doesn't. So I need to be able to assess the pelvis, find out which joint moves well, which joint doesn't move well, look at which muscles are working and which muscles are perhaps not firing so well, so that I can understand the reason for the pain. That's very interesting. So the loading mechanism through this side of the SI joint is not working brilliantly. You're not able to transfer the load, and that's quite relevant to life. You know, if it's quite hard to move that leg around, that's going to be causing problems. So my initial thoughts, just from listening to Becky chat, are that she obviously had some issues in her first pregnancy. She's got to 25 weeks this time, which is, you know, she's obviously doing reasonably well. So we're looking at something that's got a fairly low level of irritability. So I'd be interested now just to look at what her pelvis is doing and decide what we think is going on.
Treatment involves using manual therapy techniques to help the joints and muscles around your pelvis and back to function normally. It includes ongoing assessment of how your joints and muscles are responding to the treatment. This helps the manual therapist decide how to progress your treatment.
Let's get you lying on your side, facing that way. So I'm going to free things off, mainly on this side. Give me a good chance of moving things. So as well as treatment in the clinic, your physio should also be talking to you about what you're doing at home. Most often this will involve some form of exercises that you do that should link directly to what they feel the problem is. So it shouldn't be just a list of exercises, it should be specific things that tie into the problems that they're finding with you. But they may also talk to you about your general activity level. We're always keen to get people active, but sometimes that needs to be done in a slightly managed way. Sometimes things can initially be a little bit uncomfortable when you start to get things working, but really pain shouldn't escalate with an exercise. And it's worth talking through with your physio if something is very sore when you're doing it, whether that's appropriate, whether it should be getting more and more painful, and usually that's not the case. Sometimes we have to manage exercise alongside pain, so it may not be a pain-free process to exercise, and it may be that we need to exercise with a degree of discomfort in order to get past the problem and get you better, but that needs to be carefully managed between you and your physio. Just going to glide into that SI joint. So I'm just going to do that pressing through your hips again. The pelvic floor system, which sits inside the rim of the pelvis, and obviously therefore has a big role to play in the function of the joint system of the pelvis. So in amongst assessing all of the muscle system, the pelvic floor may also be something that needs to be considered, and pelvic floor function. And sometimes that can be the primary problem, so it may be that actually we divert treatment to much more of a pelvic floor bias, and that may be exercises at home, or it may even be manual treatment to reduce some of the tightness in that pelvic floor so that the muscle system can work effectively to control the joint system.
Some women find that their pelvic floor muscle problems also affect their pelvic joint pain, and this can slow down their recovery from pelvic girdle pain. This is when specialist physiotherapy treatment of the pelvic floor may be needed alongside the manual therapy treatment.
Hello, my name is Maeve Whelan and I'm a chartered physiotherapist in private practice in Dublin. I work in the field of obstetrics and gynecology and pelvic health, and I treat chronic pelvic pain. So chronic pelvic pain in pregnancy can come on as a result of a few things. It may be that the pelvis is being overloaded, and as a result of that the pelvic floor starts working really hard and problems can follow up from there. On the other hand, it can be that this is something that was there already before they even got pregnant. What you need to do is access a physiotherapist who works in the field of women's health, because pelvic floors really do need to be assessed individually. We can't say that one person needs to do the same as the other. So it's really important that your pelvic floor is assessed. Let's just have a look at the anatomy of the pelvic floor and see why this might be happening. So here are what are called the deep pelvic floor muscles. You have at the back, you have the pelvic bone, you have the sacrum, the sacroiliac joints on either side, and then the pubic bone at the front. So you have here the pelvic floor muscles. So this is the deep muscles going from back to front, as I've shown you, the back passage, and you have here the vagina, entrance to the vagina and the urethra. Then you have the more superficial muscles on top of that. So we have here the back passage, entrance to the vagina and the urethra. So this is the superficial pelvic floor muscles, and this is the deep pelvic floor muscles. So if we have a look at what might be happening in pregnancy, this unequal movement or load or weight transfer through the pelvis, the pelvic floor muscles might then tighten up quite a bit, trying to adjust to or compensate for what's going on at the surrounding joints. So if these muscles are over tense, they can in turn cause further movement dysfunctions on either side, and that can affect in turn the spine. So what is a women's health physiotherapist going to do? So we need to assess, first of all, what's going on with the pelvic floor to determine whether the muscles are held high, held tight, or whether they're releasing out correctly. If everything is held quite tight, it will be important for your physiotherapist to release the muscles out. So to do this, we might address how somebody is breathing, whether they're holding the muscles of their tummy in too tight. Then the next thing we want to do is teach people how they are sitting and whether they're further feeding into those holding patterns over the course of their day. If it's a thing that we can't get the muscles to release when we're doing breathing, then we need to perhaps consider manual therapy. So manual therapy of the pelvic floor would be performed internally or externally. If you were comfortable with the physiotherapist performing manual therapy internally, that could be either vaginal or rectal. So if there are taut bands throughout these muscles, if there are trigger points throughout the muscles, if everything is held quite tight, it will be important for your physiotherapist to release the muscles out. So we identify whether there's taut bands, tension or pressure through here, around the back of the rectum. Internally we can assess all the way around to the lateral walls on either side. So afterwards it's important then, when we have established that we can now release the pelvic floor, we need to perhaps then go on and strengthen it. We might imagine the idea, and you might have heard it before, about an elevator. So we go up in the elevator shaft up to the 6th floor, and then we come back down to the basement. So important is, when you contract, that you think of tightening up, and that's going up as far as the 6th floor when you do a pelvic floor squeeze, and when you release out, that goes all the way down, not to the 1st floor, not to the ground floor, but all the way down to the basement. And holding for the count of 10, repeating that 10 times. When we have learned that, then we go on and we learn how to strengthen and to get our core control and to return to normal activities of daily living.
People often come in and are anxious about taking pain relief for various reasons. People often say to me, I don't want to mask the pain, I want to know what's happening. I'm not really getting better if I'm just having to use pain relief. But actually for me it's really important that we can control your pain system so that A, we can treat you, I can actually do things to you without it being agony, that your muscle system can work well, because when pain is present, muscles will not work to their best. It may be medication that we think about, it may be simple things like heat or ice at home, it may be activity management. There's lots of ways, but controlling the pain is a very important component of treating you. Pain is driven by many factors, so the way that you're feeling can often have a big impact on how your pain then manifests itself. As part of your treatment package, it's important that you and your physio also recognise that maybe you need to seek other help, maybe you need to talk to a counsellor, maybe you need to go and see other people who can help you manage that emotional side of things. Or it may be that simply expressing those fears and concerns to your physio or to friends or family can help to ramp down that issue and reduce some of the pain as well. Right, are you okay?
Yeah.
Very often the treatment for pelvic girdle pain, particularly in the past, was more based around aid, so people were given belts and crutches, and that can still sometimes be helpful, but it is always really only as part of a treatment package that I would use belts and crutches. It is really important sometimes to control pain, so if someone is very sore and really struggling to manage, then using belts to give some support and some pain relief, or crutches to make it physically possible to function at home, is absolutely appropriate, but only as part of a package of treatment. What happens if you have a go at lifting that leg? That was quite hard.
It's a lot easier.
Yeah, there we go. Over the course of a few treatments, you should find that your physio has an understanding of what they're trying to achieve and what the problems are, and has a treatment progression appropriate for that. You may not instantly feel better, although markers should improve. So you should be able to say, this is better, I can do this better, but maybe my pain is still here. It's unusual for everything to resolve instantly, but something should change. Pain often lags behind function, so I very often find people will come in and say, I can now walk equally, I can now get up and down the stairs, but actually I'm still sore at certain times, and that's a normal kind of finding. But things should definitely be changing. So if after 2 or 3 sessions really you don't feel any different, then it is worth questioning the person that you're seeing, seeing if they feel happy and they understand why that is, or possibly thinking about getting another opinion. And just have a go at bending forwards again for me. Brilliant, yeah. So that looks lovely and symmetrical now. And back up again. Yeah. Feel better? Yeah. Just show me that bending forwards again. Brilliant.
Yeah, there's no pain at
No,
all.
and back up. A much nicer movement through the bottom of the back. And back down. Excellent. Very good. I would send you away and see what happens.
Great, thank you.
If it's moving loads better, it may be that that's enough. But,
Yeah, great.
but see what happens.
Lovely, thank you
Is that
very
right?
much.
So just to look back on what we've done, that's taken me about 25 minutes to meet Becky, find out the information that I needed to know from her, assess her and treat her. I can be fairly confident that her pain will settle down and may well stay settled.
I was amazed at how quickly that happened, and it felt really stiff and horrible to start with, and then everything was moving freely, and the pain was relieved almost immediately. It's quite amazing. Yeah, I'm really happy now, and I'm feeling a lot more confident about the rest of my pregnancy. As the pregnancy progressed, the baby got a bit heavier. I had to go and keep getting treatments quite regularly, but I kept on top of it, and it meant that I could enjoy my pregnancy, I could enjoy my life. I kept going to the park with my baby. I went into the birth with no pain, and delivered Clara at home in a water pool, which was a really lovely experience. When you waiting for treatment, so you've got an appointment, it's a couple of days time, and you're feeling, I want to get this over with and get it sorted, and then you go into the physiotherapist, they sort you out, and then you come out and you can move again, you're smoother, you're not in any pain anymore, and it's fantastic. I can appreciate so much now that I can do all the things that I want to with my children without any pain at all now. I'm just so grateful that I found the Pelvic Partnership the first time.
Are you experiencing pelvic girdle pain? We offer information about treatment and management, emotional support, and a free telephone helpline. Visit pelvicpartnership.org.uk or call us on 01235 820 921. Thank you to everyone involved in making this video, and in particular to the Big Lottery Fund and Tesco Bags of Help for funding this project.